a new report by the Teddy Bear Foundation has found, or rather brought into focus, the alarming low conviction rates of child abuse cases in South Africa. Now, as per the report, only 4% of over 5,000 child abuse cases result in convictions. Joining us to unpack the report is Teddy Bear Clinic's Dr Shaheda Omar. Good evening, Dr. Omar. Thank you very much for joining us on the program. Now, that figure of 4% convictions out of 5,000 child abuse cases is beyond worrying. It's actually painful. Painful for the victims, painful for their guardians, and quite discouraging to society, because you have an abused child who embarks on this very intimidating and traumatizing legal process only for the perpetrator to go off. Just take us through your findings.
I think what's important to understand, firstly, that child abuse in South Africa is a pervasive issue with significant psychological, physical and social consequences for victims. And despite our legislative reforms intended to protect children, including the Children's Act, the Criminal Law Amendment Act, Child Justice Act, many children continue to experience physical and sexual abuse, and few cases lead to convictions. So if we look at the findings of this study, what it actually highlights is the significant gaps in the criminal justice system's ability to secure justice for child victims, with only 15% of cases reaching finalization and a 4% conviction rate, as you have articulated. It is evident that there's systemic issues here, including lack of evidence and prolonged court procedures, hindering continued engagement with the court processes, and I think also where there's withdrawals as a result of that, because there's delayed prosecution and parents and families are often deterred, and because of the frustrations, because of the painful nature of the cases, having to repeatedly go back and forth to court is a daunting experience, not only for the caregiver, but for the child. It's repeated trauma, it's deep wounds. Those psychological wounds do not heal that easily. Physical wounds disappear, are no longer overt, but the psychological wounds linger, and often parents disappear. They go AWOL, they take their child and they run because they feel there's no closure, there's no help, there's no healing taking place. So it's actually further trauma where the justice system is failing our victims. Instead of helping and healing and giving closure and ensuring that there is justice at the end of the day, often children are further violated by the very systems that are supposed to protect them.
Before we look at your recommendations to close these gaps in our justice system, firstly, I want to talk about your court preparation program that you have for victims. Perhaps just to put into greater context for some of the people on just the issues. Can you just share clarity on how the program is able or unable to prepare victims for their court appearance?
So very important, when a child reports, or firstly makes a disclosure, and then it is taken to be reported to law enforcement agency, the police, the Family Violence, Child Protection and Sexual Offences Unit, a criminal case will be then opened. Once a criminal case is opened, it's investigated, it's interrogated, and of course evidence is then sought, whether it's collateral evidence, whether it's DNA, forensic evidence, all of that is part of this process. And we know that with the challenges with the gathering of forensic evidence and the backlogs creates a huge delay in the process of finalizing cases. So that's a process. But what we get involved with is not teaching the child what to say, but empowering the child, enabling the child to understand the court processes, to identify who's who in the zoo, who is the magistrate. And in layman's terms, the child will say, that's the boss of the court. We ask the child, does he know or does she know anything about the merits of the case? They are informed and they learn to say, well, the magistrate knows nothing and I have to tell my full story in court to the magistrate. We also make the child understand the different role players, the expectations of the child, where we inform the child and make the child aware of his or her rights, that it's okay to say, I can't remember, I don't know, I'm tired, I need to rest. Or if the child feels that this is too much, they can say stop at that point. So it's all about empowering the child, allaying fears and anxiety, allaying and alleviating fears and anxieties around the court processes. And we have to say that children are often, after they've completed the process, we do a competency test and they show very promising results on the competency test to be able to testify in court competently. So we work with both with the child and with the parents, where our role with the parents, when they relay their experiences, their lived narratives, their concerns around delayed processes, around investigating officers changing or not contacting them, missing court appearances where they have not been informed, we would then work closely with the NPA, the prosecutors, to follow up, to fast track, to address irregularities. Of course, we also have limitations. There is so much we can do, but we try and support as much as is possible.
No, it's most certainly a very important resource, one that actually, let's hope some would extend to even adults that come before the justice system, because they would also need that assistance to prepare for court.
But it's also important to understand we take the child into a real courtroom.
Yes.
So it doesn't come as a shock, as a surprise. They are equipped, they are empowered, and they are less fearful of their daunting experience.
But then, Doctor, with all this preparation, still you have cases or you have suspects who are acquitted, cases are dismissed. You speak of an urgent need for structural change. Can you just elaborate on this change that would assist in securing more convictions?
Well, firstly, if we look at the professionals, in terms of communicating with children, there's lack of sensitivity. They are not, trained in how to communicate or engage with children, not understanding that trauma impacts on the brain, that sometimes there's repression, there's dissociation, there's fragmentation. So a child may not make a disclosure or may not reveal a fact during the process of making the statement. But months later, after the child has received therapy, the child may then bring in additional information, and suddenly, where did this information come from? So a lot more training, specialized training needs to be done in engaging with children. And of course, we have to look at our forensic, gathering of forensic evidence, because often there's a challenge around the gathering of information and sometimes the delays that we are faced with, and also ensuring that child victims receive ongoing psychological support. Trauma does not have a timeline. Some children will take this into their lifespan forever, and at different points in their lives, different stages, different life crises, it will trigger, and they'll have full-blown episodes where they would not be able to contain themselves or manage what they are faced with. So yes, these are things that have to be addressed. I think, unfortunately, together, this is not a one-man show. I always say taking a child through the court process requires a holistic, collective effort in ensuring that the child is not further traumatized, that the child sees justice and feels that justice has been attained.
Indeed. Doctor, thank you very much for joining us on the program. And I suppose a very important take home that trauma has no timeline. In fact, healing is not linear. 1 minute, a child could have accepted what has happened, and then many years later, they're traumatized all over again. Thank you very much again for joining us. That's Teddy Bear Clinic's Dr. Shaheda Omar.